Okay, good morning, everybody. We'll go ahead and get started. Thank you so much for joining us on this beautiful spring day or morning. My name is Robin James, and I serve as the Director of Marketing and Innovations for Middle Alabama Area Agency on Aging, also known as M4A. And this morning, we're really delighted to present our Take a Stand for Caregivers free 1-hour CEU webinar. And the topic is transitioning a loved one, and I added, or a client, to hospice care. And I will properly introduce Miss Paige Landry, who's a registered nurse with ExpectCare, Hospice and Palliative Care. But before I do that, I just don't know why there it is. I just wanted to remind those of you attending this morning who are needing a CEU or continuing education unit, which is provided by Carlette Smith of HR Option Solutions, LLC. So thank you, Ms. Carlette, for partnering with us on these monthly webinars. And just some real quick housekeeping rules. You must all complete your evaluation and send it to that website there, which is www.humanresourceoptions.com. I know a lot of you attend these every month, so I hate to keep repeating myself, but we do have some new registrants this morning. So please make sure that you do not put your business address for it's to report to the licensing boards. You must use your home address and your personal cell or home number. And again, submit them within 24 hours of this class, no exceptions. And you can always email Carlette or myself if needed, if you run into an issue. For those of you who are sharing a room to view this webinar this morning, each person does need to register for the class. And so you can always put a note in the chat box to the hostess that, which is Jennifer Fuller of our agency. So thank you, Jennifer, that you are all in a group. We want all of you to receive your CEUs. And then some of you may be calling in by phone and not on the Zoom link this morning. Please make sure to identify your phone number that you called from to cross-reference for Ms. Smith. And then anyone who has not registered and their name or phone number is not on the Zoom report, unfortunately, you cannot receive a certificate this morning. Just as a reminder, M4A is one of 13 local area agencies on aging. Your local AAAs cover every county in the country. And so for Alabama, we do have every 67 of the counties is covered. And as you can see on the map there, our colleagues and partners across the state. And so our overall mission of the Aging Network is to help individuals of all ages age in place within their community. And again, we always encourage any consumer of any age to start by reaching out to their AAA or their area agency. And what we have is an Aging and Disability Resource Center. And that really is a great business model because it serves as a single point of entry to receive resources, information, and services. And so there's one really easy number in Alabama, and that's 1-800-AGE line to be automatically connected to your local area agency on aging. And just as a reminder, these are some of the core programs and services that the Aging Network, including M4A, we do cover Blount, Chilton, St. Clair, Shelby, and Walker counties. And 2 of our programs, we also cover Jefferson County. So we do the Elderly Nutritious Program. We have a lot of, these are federally funded programs. Our Alabama Cares provides caregiver support. State-funded Senior RX is medication assistance. We do a lot of Medicare counseling. So if you serve Medicare beneficiaries, please, and they have any issue with their Medicare, please always refer to your local area agency. We also have the federally funded Senior Employment Program, and we do cover Jefferson County with that. We do a lot of legal assistance through Jan Neal, which a lot of you have heard present her webinars with this series. We do a lot on elder abuse prevention, and our biggest program is our Medicaid waiver for long-term care support. So I'm not going to go into all of those programs. We are completely revising, actually starting, I think Monday, we'll have a brand new M4A website for y'all to look at. and it's a lot easier to navigate. We created this one about 5 years ago, so it was time to just do a major overhaul and upgrade. But you can easily refer somebody from our m4a.org website. And so you can just click the button, make a referral, and fill it out electronically, and it'll go right to our Aging and Disability Resource Center. And then one of our specialists will call that person back. So again, if you don't know where to start, always start with your area agency on aging. And then before I introduce Paige, I did want to just share some really good news. And I know I've brought this up on other introductories of these webinars, but we've come a long way in the last year and a half. We started developing through our nonprofit For All Foundation. We just received quite a bit of funding from the state legislatures and the governor's office through this legislative session. So we have actually purchased the Montevallo Elder Justice Center building. You see our new logo on the left. And just as a reminder, we will officially open June 15th, which is World Elder Abuse Awareness Day. So we encourage you all to come out. We're partnering with Department of Human Resources. We'll have t-shirts, lunch, resource fair, and I'll be getting a flyer out next week to everybody. But this model is really a great model because it's similar to the domestic violence model, which everything is housed under one location. And so as you can see on the right, we will serve as Alabama's Elder Justice Resource Center. We'll provide a lot of direct services to victims, older adults who have not yet been victimized, and family caregivers. We're going to serve as a technical training center for professionals and law enforcement. We are developing countywide elder justice networks. We are opening an adult day health program, and we're partnering with UAB nurse faculty. We have them on staff or contract. And then next year, we will actually open an elder temporary emergency shelter. So anybody more interested to get this information, it's a real easy website we've developed, and it's elderjusticeal.org. So we're really proud of this initiative. And again, we've had so much support and just a lot of partners helping us with this. So thank you all, everybody that's been involved. Paige Landry is a wonderful partner, ExpectCare, with our agency. She is a registered nurse and serves as a sales director for ExpectCare. Paige received her bachelor's in nursing from Jacksonville State University in 1995. And Paige has spent her entire career serving the senior adult community, whether it's through nursing homes, senior living communities, home health, and then the last 13 years with hospice. So she always says her heart is really with hospice. And we know that once you meet her, you'll know that is just a true statement. She's just very passionate. And then she's married. She's been married, and she has a 22-year-old son and a 14-year-old daughter, and they live in Helena, and she's very involved in the community. So, and Paige and ExpectCare has been one of those partners that has really helped us with the Elder Justice Center. So Paige, I'm going to go ahead and you just let me know when to switch your slides, and I'm going to turn it over to you.
Oh my goodness. Thank you so much, Robin. Can you hear me okay?
Yep, perfect.
Okay, well, good morning, everyone. I appreciate Robin and my partner there at M4A helping me with a slideshow. I had a little technical difficulty this morning. You know how that goes, but it's very important to me that we talk about something before we go into the ways to utilize the resources that we offer at ExpectCare. Actually the hospice benefit under insurance. I do want to stop for just a moment, and via means of this PowerPoint presentation, I want to talk to you about something that I feel will be very familiar to you. If it's not something that you are experiencing personally, it's something that you will at some point, probably sooner than later, experience, or you're absolutely, as a professional, dealing with this within your institution and with those that you serve, and that is caregiver burnout. The whole chaos of what we've experienced with COVID has made what was already a difficult process as a caregiver, extremely more difficult. And I know if you could talk to me in person, you would say amen and raise your hands, but it has definitely been a difficult 2 years. Before we get started, I do want to take just a moment and define what caregiving really is. I mean, obviously, we know that that is caring for someone else, but I want to go just a little bit deeper and look a little bit more as to what this could look like. And when you really think about the role of caregiving, it can mean so much more. So, as you will see on the screen, a family member or a paid helper who regularly looks after a child or a sick, elderly, or disabled person. We know that to be a caregiver, but I do want to highlight that that person is not always family. So this takes me back to those that are serving in our hospitals, in our clinics, in our nursing homes, neighbors that you may care for within your congregation, your friends, and just within the community. So I want to really focus on if you regularly look for someone, if you care for someone on a regular basis. And for myself, I just want to share that that's for my mom across the miles. I'm an hour and a half away from my mother. She's 85, widowed, still lives at home. Many of you can probably relate to that, but there is not an hour every day that I don't wonder, did she eat this morning? Did she take her medicine? I call her going to work. I call her coming home from work. So I'm not actually going to her house daily or taking things to her, but I'm regularly, consistently concerned about her well-being. So that could mean so much to so many. Okay, let's go to the next screen. Whether the person is a friend, you guys, a family member, a community member, or even a pet, let's think about those pets. We have to go home and let them out in the middle of the day. When you are regularly responsible for the livelihood of someone else, that is a caregiver. That is a desire to serve coupled with the nature of the specific duties in which they perform. So that could mean, picking up groceries, delivering a hot meal, picking up medicines, or just across the phone. It is important to understand how the role of being a caregiver has impacted your own well-being, your health, and discover a plan to improve. This is especially important when you consider the needs will not stop or change for the better in most circumstances for an indefinite amount of time. In other words, you guys, you simply must go on. It's interesting to me. We can all relate to this, I'm sure. When you're taking care of someone else, bills still come, responsibilities still come. The world does not stop because you have a crisis. Care does not stop. The needs of those that you care for, maybe in a facility or maybe even in your home, they don't stop when we're shorthanded. So, and then let's talk about the pandemic. When telehealth visits were taking the place of going to your appointments, or maybe you just couldn't get to the regular health care as a caregiver that you needed or your loved one. So things maybe spiraled a little bit out of control. Absolutely. Okay, let's go to the next screen. So let's talk about, when does one burn out? Well, absolutely, in a pandemic, that is something that we are hearing within our organization more than ever. Just the respite opportunities, which we'll talk about at the end of this presentation, that's offered under hospice care, a lot of times will be the very reason that a caregiver elects the hospice benefit, because they just need a break. So for purposes of this meeting, we're now going to look at when this happens. So let's go ahead and go to that next slide. Burnout happens at a different time for each individual. It's basically based on your circumstances. That's pretty self-explanatory. But this is a common denominator, you guys. It seems to be when the caregiver ignores what they need to do to meet the needs of others, and suffering begins. It could be a difficulty for the patient that you're caring for because you just can't meet the demands, or for yourself. Maybe you're taking excellent care of someone else or a group of someone else's, but you're not providing great care to yourself. And so either way, this is a real burnout situation. So for a moment, let's talk about you. Okay, so if you'll click on that link at the bottom, if we were in person, I would provide this handout to each of you. But for purposes of today, we're just going to kind of look at, and I would love for Robin, if you'll click on that link on the bottom of the screen, it should allow us to share this handout. Maybe try to double click it.
Do you see it? It's there.
Oh, you can see it? Okay.
Yeah.
So I can't see it, but that's okay because I know it pretty well. You'll see down the left-hand side, you guys, it goes through several different aspects of your health, your mental, your physical, your spiritual, your emotional. And there are a series of questions that you simply answer yes or no. At the bottom of this quiz, if we were in person, we would score where you are. I would love, love, love for you to take a moment and take this after this presentation and reach out to me about the scores that we're about to go over. It's also a great tool for you to use if you function as a case manager or a social worker where maybe you have a family or a client that is, I hate to say difficult, but there's just a lot of needs. You know, you're spending more time with this particular family than anyone else. There's probably something to be said about them being at a place of burnout. So the purposes of this quiz is to lead you to being brave enough, obedient, responsible enough to reach out for help. So let's see if we can go to the next slide. Okay, so in general, as we take this quiz, these would be the things that we would discuss. Are you feeling overwhelmed? Well, that's probably everyone on this call. Honestly, by 8 o'clock every morning, I'm like regrouping, and wherever I thought I was going to go that day looks completely different, personally and professionally. So it's not unusual for each of us to feel somewhat overwhelmed in our day-to-day task. Weight gain or weight loss. You know, your appetite may be more or it may be less based on the stress that you are under. Sometimes people are stress eaters. You know, it may not be how much they're eating, but what they choose to eat. You know, they're on the go all the time, so they're running through and grabbing fast food. It's cheap, it's fast, but it's always, you know, it's not always the nutrition, balanced nutrition that you need. A lot of our families say, I just can't eat. You know, I'm so worried, I'm not sleeping. So, you know, a good meal is the last thing on their mind. Fatigue, just feeling tired. I think that we are all coming out of this pandemic, if we can even really say we're out of it just yet, a little more tired than usual over just what we've weathered over the last couple of years, trying to check off all the boxes, do all the things that we need to do while still managing our day-to-day task. Maybe you're someone who used to go to the office and you were surrounded by a support system, and now you're working from home. And so it's you and those four walls, and you're trying to do the same amount of work, but you don't have that support system around you. You know, a little laughter in the hallway is good for the soul. So that could definitely be something for you to think about. Not necessarily something that you can change, but something that has changed your outlook. Changes in your sleep pattern. You know, some people sleep more because they're depressed and overwhelmed. Some people can't sleep at all. Again, guys, this affects everyone differently, but you know your norm. You know those that you care give for their norm. When these things are yes, 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 and yes, we need to talk. Series of emotions. You know, it's one thing to have something to make you sad, but it's another to not be able to get away from that emotion. Maybe you're more angry than normal. Maybe you're, you know, sad, but you're sad all the time. Outburst of behavior, being short fused at home, you know, being more forgetful just because your emotions are taking over just your organizational thought. Body aches and pains. You know, our body is designed to respond to stress, to respond to changes. That's why we have fever when we're sick. That's why we have aches when we're hurt. So body aches and pains are absolutely also related to our nervous system. So if you're on heightened awareness of just your emotions, then that could come out, especially in like, you know, worsening of arthritis or just, you know, pains that you're like, I haven't lifted anything, I haven't hurt myself, but I'm just achy. That could be a direct result of stress. Loss of concentration. I hear this a lot. I make a list to go to the grocery store, but I forget the list, or I take the list and I can't get everything on it. Just not being able to go through the checks and balances of the day, not being able to complete the task, being able to go to all the places, do all the things. All of this, it can be directly responsible for a lot of things that you're going through, and roles that you're playing, but also for caregiving especially. So if we can go to the next slide, this should start to get us into our scores. So on that caregiver quiz, as you do that, or you provide that to someone, at the bottom, if they score 5 or less, so this is going to be if they code 5 or more 5 or less yeses on that quiz, it sounds like you're actually managing at this time pretty well, um, despite the challenges. However, it is a long-term commitment. That's one thing about caregiving. It's not something that you can say, well, I've got to do this for 2 more weeks. Sometimes maybe you're going to place your loved one at a higher level of care, perhaps in a facility or with another family member, and you do have a stop date for that. But remember how we talked about across the miles? Just because you may not be directly providing that care to them, if they're in your thoughts regularly, if you are regularly concerned about their well-being, then that is still a caregiving role. So 5 or less, you're doing okay. It doesn't mean when I go over the things that our services can provide that you wouldn't be a candidate. It just means that maybe now it would be helpful for you to learn a little bit more about the services and then know when it's the right time for you to access that. But 5 or less, we're going to cheer you on. You're doing okay, but we're not going to count you out. Okay, let's go to the next one. Things that you can do, 5 or less, these guys that are managing pretty well, be in control of how you're doing. Monitor those emotions, deal with them as they come rather than ignoring them. In other words, allow yourself to feel. It's okay to cry. We talk a lot of times within our organization, being faith-based, Jesus would often retract into the garden or step away, and he would cry out to the Father. I mean, that is a God-given emotion to cry. It's just not okay if you stay there. It's okay to feel those things, but it's a problem if you stay there. We want you to be able to continue to go on. Care for your health well by proper nutrition, excuse me, and hydration. Take frequent rest breaks for yourself. A Sunday afternoon nap is a great idea for all of us. Recognize what your limits are and try to stay healthy. I really have to talk to myself about this, learn to say no to things that add additional strain. Robin will tell you, I'm a yes girl. If you call me, I'm probably going to say yes to just about everything. But one thing that I have gotten better with is my mom has aged, is calling my sister and saying, hey, would you mind to pick this up for mom today? Or, I'm not sure I'm going to make it down Saturday. Can you do this? Where before, Paige would try to take all of that on herself. So, if it's something you've committed to and then that is stressing you to the max, raise your hand and say, hey, girl, I love you. Can you help me with such and such? And that's okay. It's actually a sign of bravery to reach out and ask for help. And a lot of times asking for help is that person's blessing. People want to help you. They just don't always know how to do it. I've found when I say, hey, can you do A, B, and C for me? They'll do it. But to just knock on my door and say, hey, what you need today? Maybe not. Okay, on the test or on the questionnaire, if you score 6 to 10, okay, we want to park right here for just a moment, you guys. This, I feel like, is more than most. And then in the next group as well. But this middle area, I'm finding that this is a lot of my caregivers that are in, hospitals, in nursing homes, not just our people that are home trying to do it in the residential homes, but our caregivers that are carrying the badge behind their name. I'm probably talking to you today. You're flirting with burnout, you guys. This person will often feel as if they're having a moment. But those moments, if we're honest, are sooner and closer together than they've ever been. This stage is often a turning point that will lead to, saying to the person beside you, or when you come home to your spouse or your family, I just can't, I don't know if I can do it anymore. I just don't know if this is the right place for me. Walking away when that care is truly needed. We find this sometimes with our caregivers in the home that, they're inundated with caring for mom or dad. They're still trying to keep their job. So we know that mom's a little confused. We're just going to try to put as many safety nets in place as we can. And we're going to go to work and just pray that she'll call us, if something changes. So this is a concern. This is a very big concern. It's not always best. It's not always ideal. It's just what people have to do. So I feel like I'm talking to most when we share this group. Attempt to evaluate how much longer the caregiving will be needed to allow for planning. So if this is your job, more than likely, this is the career choice for you. This is where you plan to retire. If this is someone that you're caring for at home, you may not can say how much longer this is going to happen. But in other words, you're finding yourself saying internally to your own being or to others, am I going to be able to keep doing this? Will I be physically, mentally, emotionally, and financially? That's a big one. Am I going to financially be able to continue to do this for what appears to be X amount of time? This is where community resources such as ExpectCare, all of our community partners, M4A, home health, Medicaid waiver, all the things that Robin said, our competitors, our friends, everyone. This is where we need to talk to you. It's a better way to meet the demands of the patient, which also allows you to have some assistance to continue that care for your loved one. It's a big deal, you guys. All right, on that quiz, oh my goodness, if you're 11 to 15, mild to moderate burnout, again, these two categories are where we're finding most are and have been for 2 years. This is where the mind and body have been trying to tell you something like, you're doing too much, girl. You've consumed your life with caring so deeply for someone else or someone else's or those within a medical place that your own needs have been neglected. You're taking extra shifts, not necessarily because you need the money, but because you're so shorthanded. More importantly, being here makes you at greater risk for chronic conditions or even premature death. This is a concern for you, and it's also a concern for those that you care for. That is something that we don't always want to see or admit, but it's true. When your own self-care is neglected, you're probably not providing the care that someone else deserves. And I believe that that's why we're hearing so many concerns from our families when we have the opportunity to sit down and meet with them about our services, with their frustration, that we can't get information. We call and the phone rings and rings and rings. No one answers. All the things, you guys, we're living it every single day. We're doing the best we can, but that is what we're living. So, it's not going to yield good outcomes, patient satisfaction, customer satisfaction, and it's certainly not going to be good for you. So what can you do? Well, you can ask for help. Number one, that's the most important thing, is to raise that hand and surrender. It does not show a sign of weakness. It actually shows a sign of bravery to say, you know what? I want to do all these things. I'm actually doing all of these things, but what do you have for me? Like, how does this relate to me? And we're going to spend some time in just a second talking about what we can do. Consider support groups, guys. This is something that's been near and dear to my heart since I joined the ExpectCare team back in August. We had a hard time getting into a lot of our accounts still at that time. We were kind of coming out of that COVID wave that we have been in, and you could meet out on porches and different things. Some of that's starting to relax a little more now, or has relaxed. Caregiver support groups that were once started or getting started back or need to get started back, and we're actually hosting a grief support group at our office today. So if you know someone that's suffering from grief, we've started that. We do have support groups coming. Allow your friends to help you. your congregation, get back in those Sunday school classes, meet a friend for dinner. If someone calls you and says, hey, can I drop dinner off tonight? Say absolutely. If you've got dinner cooked, say absolutely. You can refrigerate that and eat it tomorrow night. Let people love you. Consider any and all resources. Ask questions. Gain understanding and knowledge. I always tell my providers, my families, when I meet with them, power. Knowing knowledge is power. Knowing what's available to you is power. Puts control back in what you're doing when the time comes. Ask questions, gain a better understanding, and talk to your doctor about your well-being. Talk to your doctor about what you need for yourself, but also what you need for your loved one. I would love to share with you this morning that every doctor is forthcoming with what we can provide, but I would be lying to you. I know there's several reasons why I think that is, and it depends on who we're talking about. But honestly, if you think when you go to the doctor that they're going to tell you that you can get these services or offer these services to you, you're going to be disappointed. You most often have to ask for referrals to be made. You have to let your doctor know what you're having difficulty with. Then they will usually talk to you or provide a referral to an agency. So, be assertive, be bold, ask questions, know what's available. Okay, and 16 to 20, guys, this is severe burnout. This is a real crisis. This is an emergency. This person has pushed beyond their limits. At this point, your welfare, as well as those that you care for, is and has been at risk. You're at a greater risk for anxiety, depression, heart attacks, and stroke, and so are those that you're caring for. So by trying to be the hero and do all things, you could actually be hurting the person and yourself that you're caring for. I'm very concerned about you. It is okay to talk about you. You're the top priority at this time, okay? We're talking about severe burnout, you guys. Let's go to the next screen. At this time, if you have not yet spoken to your doctor, please, please consider doing this today. I know it's not easy to get the doctor on the other end of the line, but you can talk to a nurse. Tell them what you're experiencing and ask them what they can do to help. Make an appointment, all the things. Make arrangements for alternative care to balance your own well-being. With that, you will begin to heal. So even though severe burnout sounds like an emergency, it sounds like the end, it actually is something that you can have some interventions and start to feel the benefit immediately. So guys, I want to talk about just seasons changing. It's a beautiful time of year. We're seeing color, we're seeing blooms. It's so nice to drive down the interstate and just be surrounded by green again instead of just sticks and brown grass is so encouraging. And I believe that is. I know that is the promise of the Lord, that seasons do change. It reminds us that, whether it's good, whether it's bad, your circumstances can change. So if you feel like the walls are closing in, I will tell you, having been a caregiver and still a caregiver, whatever you're doing, one day that will change. It's not going to last forever. It's going to feel like some days that it does, but it is going to last until, and for however long that it's supposed to. And it matters how that goes. So let the seasons changing remind you when you go into summer, the beach trips, when you go into fall, my favorite pumpkin season, remind yourself that the seasons of your life also change. Where your family once cared for you, you will soon or will or are a caregiver for them. So it's a time of self-reflection that, new mercies are present every single morning. There's new opportunities, there's new challenges, but it's not going to last forever. Did you know that being a caregiver actually shortens your own lifespan 4 to 5 years? I mean, that's not encouraging to hear, right? But it's something that we need to talk about because just being responsible for someone else and the demands of that can actually shorten your own life. That's why it's important that we ask for help and do what we need to do to take care of ourselves. 85% of family caregivers in the United States receive no respite help. The final stage of caregiving is usually 4.5 to 5 years. So when we look at how it shortens your lifespan, it's exactly the time that you're caring for someone else. So when we talk about respite in just a few minutes, I really want you to take some notes and jot some things down so that we can talk. If any of this presentation has spoke to you as a caregiver, then I definitely want to talk to you about respite one-on-one. Okay. Mother Teresa. There is a fabulous documentary. I don't know if you've seen that on Mother Teresa. It just, if certainly if you're a community partner and you provide resources to someone in the community, it would be a wonderful documentary for you to watch. It's less than an hour. It just shows her life and how she spent all of her life caring for other people, just going back into the community, especially for home health and hospice partners, is very much what we aspire to be. And so many quotes, so many things that, you're probably familiar with of her, but this is what I say to our team a lot. It's not about how much you do, but how much love you put into what you do that counts. So when life matters most, I'm just asking you guys to make the time count. And so this is where I want to shift for just a moment and talk to you a little bit about our ExpectCare mission and what we offer under the hospice and palliative benefit. Our website is expectcare.com. I would love for you to take a moment to look at that after the presentation. I do want to give you, if I forget, Robin, remind me to give them my cell phone and our office and my email address to reach out to me as a point of contact as well. But basically, you guys, the service that is provided under hospice is an insurance given benefit. So it's basically and should be essentially the same from company to company. Because it's given by insurance, they tell us what we can provide. However, at ExpectCare, we are not a corporate company. We're not a huge national company that has different missions and different, organizations in different states. For right now, we plan to grow, but for right now, we are in primarily the same counties as M4A almost. We have 6 counties from Coleman, Walker, Jefferson, Shelby, St. Clair, and Chilton County. So for most of this listening audience, we definitely should be able to serve you, and we plan to grow and expand that territory this year. The biggest thing is that even though the benefit is the same from company to company, the people that provide the care is really what matters. You can go to one store chain in one town, go to it in another town, and have a completely different experience, right? And that's because of the people that provide it. In the ExpectCare family, we are a faith-based company, and that's the first thing. That's the most important thing to me, is that our believers, our community of believers, and maybe those that are struggling with their faith because of their role of caregiving or the journey that they're living, or being having to try to understand, why do bad things happen to good people? I mean, have you ever asked yourself that question? I know I have. As strong as my faith is, I have a lot of questions from day to day. Why does it look this way? Why are we still weathering COVID? Why is cancer rampant? God, you could take this. So I think coming into a hospice or near hospice situation with a team of believers is super important, because depending on where you are with your faith, it is absolutely a faith journey. Faith is the evidence of things that we don't see, that we haven't experienced yet. So when you're looking for, when is this going to get better? When is this going to change? When am I going to feel better about this? Your faith definitely has to take a front seat. It should, and it will, if you're supported in the right ways. The next thing is, because it is an insurance benefit, is fully covered under insurance. So that would be under your HMOs, your private insurance, like your Blue Cross, United Healthcare, Cigna, Blue Advantage, or traditional Medicare. We also accept Medicaid. There are not a lot of companies that accept Medicaid, and we also have a charity fund. So for our team, long story short, there is no provider, no patient that
Paige, I think I can't hear you anymore. Jennifer, can you hear?
No.
Okay.
Being recorded.
Or can you still hear me, Robin?
We can now. You went out for
Okay,
about
perfect.
2 minutes.
Okay, sorry. Okay, so if you get this service, your insurance says you have to be seen at least once every 14 days. We like to see you at least 2 to 3 days a week, because a lot can happen in the time that we're not seeing you. 24/7 access to a nurse or a caregiver. So if it's a day that we've been, a day that we're not supposed to come, all you have to do is call our office number, which becomes our on-call number. Holidays, weekends, it does not matter. That gets you a nurse on the other end of the phone. We have nursing assistants who can help you with your personal care, your showers, washing your hair, bathing. This is for those that are falling or at risk for falls. Chaplains who come and provide spiritual support for you. That can be weekly, that can be monthly, that can be daily, whatever we feel that you need. Social workers who can connect you to resources such as M4A, Meals on Wheels, respite. That is a huge opportunity that I've mentioned several times. I want to talk to you just a minute about that. For all of our patients who are on service, we do provide a respite stay once a month, once every 30 days. You can get 5 nights and 6 days in a facility that we are contracted with, which is most facilities in this area, some hospitals as well, where we pay that bill. So if your nurse from ExpectCare has been seeing you twice weekly at home, or maybe once a week or more, when your loved one, or when you go into respite, your nurse would see you daily. And that's because we know that you're in a different, unfamiliar place. And so we want to make sure that your needs are being met. You would get your medicine, your bath, your meals, and everything as if you were a patient there, if you stayed there. But the plan would be to bring you back home. So this allows you as a caregiver, or the caregiver, to have a staycation, a vacation. If the caregiver is sick, heaven forbid the caregiver becomes sick, then what do we do? So this can be an emergency placement or a planned respite stay. So huge opportunity for you to take a minute for yourself. We've been talking about burnout, and have your loved one cared for with a plan to bring them back home. So when we talk about, you guys, that this could go on for a year or months, this is a great way for you as a provider to say to your families, just, if nothing else, for this benefit, have the ability to access respite. Now, you can choose respite at facilities for your loved one, but if you're not under an insurance benefit such as ExpectCare, you're going to have to pay that bill, and that can be quite expensive, anywhere from $200 to $400 per day. So again, once every 30 days, a 5-night, 6-day respite is provided, and that is covered completely. We have volunteers that can come and be with our patients just as a companion, maybe play games. Some of our patients just still want to be, socially stimulated. Besides the health care, they just need companionship. So we have volunteers that are super excited to do that. We have physicians that can assume your physician role. If you can't go to your doctor, or don't want to go to your doctor anymore, our medical directors can take over, or they can collaborate with your physician, and your doctor can still be in the driver's seat. We do have to have an order to start this, but again, Usually when the need comes to me, like maybe through something like this Zoom call or through a meeting, and we go to the doctor, they're usually forthcoming giving me the order if I ask for it. They just don't always offer this to families. And it doesn't matter, guys. I've been doing this for 13, 15 years, and I'm like, offer this to your people. But for whatever reason, I don't know if it's just, what we're called, hospice, or if it's just, admitting that your loved one's getting worse. I don't know, but it doesn't happen like it should. We do cover all medical equipment. So that could be hospital bed, walker, wheelchair, shower chair, suction machines, breathing machines, Hoyer lifts, trapeze bars, any kind of medical equipment that's needed in the home, we cover. We can add to, take away as needed. Supplies, diapers. I mean, we're talking $30, $40 a pack. However many diapers they use in a week or a month's time, we provide those. They're fully covered under the benefit. Wipes, gloves in the home, catheter supplies, wound care supplies, all of that is provided. Also medicines, whatever medicine is related to the reason that we admit that patient. If we admit them for heart disease, we're going to cover heart medicines. If we admit them for Parkinson's, we're going to cover those Parkinson meds. Regardless of the diagnosis, we're going to cover anything for anxiety, depression, or pain, because to us, those are quality of life medications. So just a world of help. What do we do for the caregiver? Well, first of all, you're doing a really good job taking care of your loved one. It's not that you're doing anything wrong. Us coming in and helping you do that helps to take care of you. Knowing that somebody's knocking at the door in the middle of the night when you're up saying, is there anything else I can do? She's not extremely comfortable. He's not extremely comfortable. Am I doing all that I can do? Just seeing someone on the other side of the door with medical expertise that can come in and say, you know what, I would do it exactly the same. Or somebody that can come out and be like, oh my goodness, this is what we need to do. And then your loved one is more comfortable. Oh my stars. It is a world of support. We also continue to follow the family. When the Lord calls our patients home, when they pass, then we continue to follow that family, those grandkids, the daughter, the son, for at least 13 months. Like I said, we have a caregiver support group, a grief share group in our office this morning for our patients' families who have experienced difficulty over this pandemic. They're very faith-based. They know that their loved one is healed and in a better place, but Mother's Day's coming up, Father's Day's coming up. They're missing their grandkids' graduation. Just being associated with other people who can relate to what you're going through offers you a world of support. So I just want to encourage you guys to consider that burnout is truly a real thing. It is a real thing for those that you serve alongside of, those that you serve. It's a burnout world right now, just from the pandemic alone. We've got to do things differently. And so I think if nothing else, if we could get our medical providers to start partnering together more and layer these resources on top of each other. And, just like with M4A, I don't always have all the answers, but I know when I call you guys that you screen them for absolutely everything that you have. So when we admit someone, we go ahead and do that referral and we say, I don't know if there's anything else, but we're just going to check. And so I think if we can start to access each other and reach out to each other more, the person who's going to really benefit is the patient. And that's really what we're all here for. So I do want to give you my cell phone number. I would love to talk to you. If there is anything that you have questions about, or if you need to talk to me or ask questions or share what, you're welcome to share this number. I'm always available. I think I'm better at 9 even. So if you need to talk to me after work, that's okay too. My personal cell phone number is going to be 205-267-9512. 267 9512. Again, I'm Paige Landry, and I am a nurse that works in the community education role. I'm the leader of the sales department here with ExpectCare. Our office number is 205-444-0126, and our fax number is 205-444-0128. I would love to know your thoughts from the presentation today. And I would love to just hear anything that's on your heart or pray with you. So if you want to reach out to me by email, if that's easier, super easy. It's Paige with an I, Paige at expectcare.com. And with that, I hope you all have a wonderful, wonderful spring and summer. I hope to hear from you. And Robin, to you and all of our M4A family, we love you guys. We appreciate the opportunities to partner with you and just appreciate the great work that you guys do.